Melany Decker is a working mother of 3. She has a passion for her family and her garden. But once a month, her priorities changed to cope with heavy monthly bleeding, or HMB.
I had to plan it like a military operation. I had to know when my period was going to start, when the first 2 days were going to be, what I was going to do during those days, what I could and could not do. So it was really difficult. I definitely didn't want to be going to any social activities, friends' houses or anything like that. In the summer, swimming and those kind of things. I'm also doing activities with my little girl. The heavy periods drain me.
Heavy monthly bleeding can disrupt sleep because women frequently get up to change their sanitary protection.
I have to wake up 2 times during the nighttime so I can change to make sure I don't, have leakage or anything like that. I use special linens. I make sure that, when it's that time of the month, I'm not using my pretty linens or the linens that I really like because that was part of my life.
The condition affects millions of women in this country, but only 11% seek treatment, in part because existing surgical and hormonal therapies are not right for everyone.
My doctor offered me several options. The first one was a hysterectomy, which I felt was too invasive. The second one was the contraceptive. It makes me hypertensive, so that wasn't a good option for me. The last one was ablation, and that was unaffordable because I don't have medical insurance.
Then she was invited to take part in a clinical trial for an oral medication called LYSTEDA, or tranexamic acid tablets, a prescription medicine for women with HMB.
I was very excited when I heard about the study because I was like, yes, finally there is something, that might be a solution for my problem.
The clinical research showed that LYSTEDA reduced menstrual blood loss throughout all cycles studied, beginning as early as the first cycle of treatment. Melany takes LYSTEDA exactly as her doctor prescribed at the start of her period.
I take 2 tablets 3 times per day for 5 days, starting on the first day of my period. And it's very convenient. It's no problem at all taking, 2 tablets 3 times per day, and it's definitely worth it.
LYSTEDA is a great treatment for heavy periods. It's non-hormonal, non-surgical, and women only have to take it during their periods.
I just am so grateful that I was part of the study and that there is something out there for myself and women like me.
LYSTEDA is a prescription medicine used to treat your heavy monthly period, menstruation, when your bleeding gets in the way of social, leisure, and physical activities. LYSTEDA does not contain any hormones and is taken only during your period. It does not treat premenstrual symptoms, does not affect your fertility, and cannot be used as birth control. It does not protect against sexually transmitted diseases. LYSTEDA has not been studied in adolescents younger than 18 years of age. You should not take LYSTEDA if you currently have or have ever had a blood clot, have been told you're at risk for having a blood clot, or are allergic to LYSTEDA or tranexamic acid. LYSTEDA can cause serious side effects, including the risk of serious blood clots may be increased when LYSTEDA is taken with hormonal contraceptives, especially if you're taking higher than your normal dose of birth control, are overweight, or if you smoke cigarettes. Risk of serious blood clots may also be increased if you take LYSTEDA with medicines used to help your blood clot, or some medicines used to treat leukemia. Be sure to tell your healthcare provider if you take any of these medicines. Stop taking LYSTEDA if you experience any eye changes, and promptly report any eye problems to your healthcare provider. If you have an allergic reaction, have shortness of breath, and your throat feels tight, stop taking LYSTEDA and get medical help right away. The most common side effects of LYSTEDA include headaches, sinus and nasal problems, back pain, pain in your abdomen, pain in your muscles or joints, anemia, and fatigue. If you notice a change in your usual bleeding pattern that worries you, or your heavy bleeding continues, contact your healthcare provider right away. This may be a sign of a more serious condition. You're encouraged to report side effects of prescription drugs. Contact Ferring at 1-888-FERRING or call 1-800-FDA-1088 or visit fda.gov/medwatch. Please see full prescribing information for LYSTEDA.